I think it's very important for the cancer patient as well as the relatives to be able to quickly take a decision. When something like a disease which is as serious as cancer, people need to take a decision within 15 days of the diagnosis. Yes, in just 15 days, they need to make sure to start the treatment, whatever it is, whether it is an allopathic system, whether it is an Ayurvedic system, it's completely depending on how the patient is, which stage the patient is, and whether you want quick recovery, whether you want the patient to heal in a painless way. All these things are something which a patient needs to realize and the relatives need to understand. Now, I'm just trying to help you with some of these decisions which the cancer patient's relatives need to take. Like I said, one, you need to first have within 15 days, need to take a decision what is the treatment that you want to do. Second, you need to ask your oncologist which stage the cancer is in, what is the healing modalities that you have, and whether this healing modality that you're using is going to be painless or painful, what kind of side effects will be there, and whether this disease can spread to other parts of the body, whether this disease can actually be more aggravated because of the medication that you're giving me. All these questions need to be asked. You also need to check with the oncologist whether they have experience with this disease. And mind you, you don't need to just ask your oncologist whether the patient is going to survive or not. You need to check because let me tell you that we've seen plenty of cases where around 60 to 70% of the cases that come to us have been asked to go home and spend the rest of their days relaxing because you've got 2 months left, 3 months left, or 6 months left. So, why not check with the oncologist beforehand that what are the chances of survival? What is the, I'm not asking you to give me a guarantee, but what are the chances of my relative going through this journey in a more painless way, in a more, rather than being a treatment, whether the patient can be healed. That's more important because let's not forget why this disease happens. One is because it's a lifestyle related issue. It is also a dietary related issue. And thirdly, it's these patients normally have carried a lifetime of emotional baggage. It could be some kind of guilt, it could be some kind of anger, it could be some kind of frustration. So, all of this needs to be sorted when you heal a cancer patient. So, can your oncologist, can your Vaidya actually heal these issues that are the root cause of the cancer? So you need to also check with your oncologist or with your Vaidya whether they know the root cause of the disease, whether they know why the patient has got this disease. And lastly, I would also want each one of you to understand that even if a patient gets diabetes, they are shocked. So, cancer, when a patient is diagnosed with cancer, they are in severe trauma, they are in a state of shock. So, first, you need to forget about yourself and you need to think about the patient. Keep motivating the patient, make the patient laugh as much as possible, and just say that, cancer is a disease, it's a lifestyle disease, and it's not a death sentence. We've seen several cases who are cancer survivors and who have gone through this journey of healing in a very, very calm and composed way. Of course, it's a traumatic thing. We don't want to generalize about anyone's diseases. But what I'm trying to say here is you need to be a support system for the patient and be able to make sure that the patient is going through a healing journey easily. Let me just tell you one thing about research. What it talks about is that an integrated system, that, when people have been taking conventional allopathic treatments of chemotherapy and radiation for years now, but an integrated system with Ayurveda at the very beginning will make sure that the patient's survival rates increase by more than 70 to 75%. Why? One, because in every cancer patient, the immune system is compromised. Number two, the tissue health, or whether it's the blood or the bones or the organs, are in bad shape and they are very weak. Number three is that their metabolic pathways are all choked. So you will see mostly these cancer patients have a lot of constipation or sometimes loose motions. They are not able to eat properly. All these are issues which are due to choked metabolic pathways, which we've been talking about for quite some time. And because of these choked metabolic pathways, the disease starts to then make sure that the body keeps getting weaker and is not able to perform its task, which it always did all its life, of healing the body, of being able to remove the waste properly, of being able to give nutrition to the body. So when something like this happens, the food that you eat does not reach your tissues, does not reach your organs, and making you weaker. And all your cells in the body are also multiplying at a very fast pace, and your system of apoptosis is lost. Yeah. So when apoptosis is lost, can the oncologist start an apoptosis, your push for the apoptosis system to happen? Can this treatment that is being given, can they increase the metabolism and make the body again work like it used to 20 years ago? You need to ask all these questions to your oncologist, to your Vaidya, and then take a sound decision whether you want to start your Ayurvedic treatment first, kickstart the apoptosis system, and also open the metabolic pathways so that the body starts to heal itself, then go for chemotherapy and then come back to Ayurveda. Or you want to do only Ayurveda because within 3 months you can probably see a lot of improvement. Or you just want to go in for an allopathic system and then simultaneously do this Ayurvedic treatment side by side. As a relative of a cancer patient, it's not easy, absolutely, because you want to do the best. You do not want to do something which can harm the patient. You do not want to do something which can make you repent the rest of your life. So I would urge all the relatives of the patients to probably go in for an integrated system, because the chances of survival of a patient is far more increased in, and that's what has been researched all over the world. In fact, if you see Europe, America, Africa, India, Asia, all these places are now pushing the European Union has been talking about an integrated system even in their healthcare system. They are asking for all kinds of possible alternative methodologies to integrate with the oncological system. So I think in India we have this facility. Why not avail it? It's easily available and you can certainly give this a try, and the chances of survival of the cancer patient increases by more than 70 to 75%. And thank you and take care and be brave and do not worry, because this is just another disease and can be sorted if you take the right decisions at the right time and make sure that the patient is calm. Thank you.